Hi, I'm Dr. Seiler, and we're going to film me doing an IPL treatment for pigment on our great patient here. We're going to treat her arms. This is one of the areas that most people don't know they can have treated. A lot of people know they can have their face, neck, and chest treated, but we definitely can treat the arms with IPL or Fraxel. She just actually had Fraxel on her face. She's had IPL on her face a couple of times before for hyperpigmentation, and we're going to do kind of a light treatment of her arms here. We wanted to show how quick and easy of a procedure this is to get through, and it'll show how well she tolerates it. So we're about to start here. All right, you ready, Miss Long? All right, here we go. 1, 2, 3. You'll see a big bright flash. You can see how quickly this moves. Does that feel okay? Not as bad as the face? The face tends to be a little tender. The good thing about this procedure is it's very safe in darker skin. A lot of patients that are Asian have hyperpigmentation from pigment and sun damage. This is a really good procedure to help clear up their pigment. You have to be really careful in darker skin patients, and a lot of places that do this may not know that as well as they should, because you don't want to cause hyperpigmentation when you're actually trying to treat the pigment. So that's also the reason why we're starting with an IPL on her arms instead of a laser, which is a little bit safer than some of the laser devices. You don't really have much pigment on the back of your arms, do you? Just kind of on the sides. Alright, we're going to pull her arms straight. I don't know if the camera can really see the pigment. It's pretty superficial and just little spots of pigment. This does really good with minimal to no downtime. She'll have a little bit of pink today, and she's going to be on a really good skincare product that will help with any redness or mild swelling. I'm not sure if the camera's picking this up, but you can see she's not getting too red. She's tolerating this fine. You doing okay?
Yeah.
Scale of 1 to 10, how bad is it? 3. 3? Okay, good. So yeah, unfortunately in my business, if it doesn't hurt a little bit, it probably doesn't work, but you can see she's tolerating this just fine. It's always a little easier to get through this on the face than it is on, on the arms than it is on the face. The face is a little tender, but still it's not anything too bad, right? Most people tolerate it fine. It's a quick and easy procedure. You can see how quickly I'm moving here, and if you were able to see this even closer, you'd be able to see that the pigment is really coming up. Alright, I'm going to turn your arm this way just a little bit more there. There we go. It's kind of hard to probably see it on film, but if you could see it, you could see that the pigment is starting to kind of come up and will eventually freckle off over the next couple of days. Usually IPL is something you do a couple of times. In her case, I bet it will probably only be once or twice, because most of her pigment is pretty shallow and should be pretty easy to get safely. Alright, you can rest your arm back to normal position there. So that's it for IPL on the arms. I treat full body with IPL. Like I said, the most common areas are the face, neck, and chest, but a lot of people have a lot of sun damage and hyperpigmentation on their arms. It's great for the hands, which you can see here we're about to do. We'll spread her fingers out here and do her fingers and her hands.